Hi, my name is Randall A. Thanks for joining me on the Infertility channel. I'm going to be talking today about one of those tried and true techniques of reproductive medicine. It's called intrauterine insemination. We call it IUI. That means placing washed sperm high into the uterine cavity. First, a story. Some years ago, we had this couple who came to see us who wanted to have insemination. They were both lugging large suitcases. They said, please give us about 10 minutes. When we came in there, my diplomas were off the wall. They had placed their bedroom pictures on the wall. They had mood music going. They had dimmed the lights. They had converted our examination room into their bedroom. After the procedure, they packed everything back up, lugged their 2 suitcases out, and nobody in the waiting room was any the wiser. Fortunately, they became pregnant, so that was the very first and the very last time I ever saw the inside of their bedroom. Obviously, insemination requires both the collection as well as the washing of the semen. So you have to have the ability to collect a specimen, usually through masturbation. The collection is done in a sterile container. That collection is placed into the lab. The laboratory people will spend probably close to an hour washing that specimen up. So what does that mean? It means that we're going to get rid of the prostatic fluid, the seminal vesicle fluid, any white blood cells, red blood cells, any debris, say protein particles or gel particles, and we're going to get just the best sperm. We're going to try to wash out the ones that are abnormal, the ones with the big heads and the little heads and the too many tails, etc. And so we're left with just the best sperm. And we place that into an antibiotic containing medium, just a little bit of fluid. And then we place that into a special little catheter, a little tube. This catheter is different from the one that we use to do that X-ray on the uterus, the HSG. This goes painlessly up into the uterus, and then we inject, it's usually 0.6 milliliters, just a couple of droplets actually. We've concentrated all the sperm, and then we take this out, and it's a painless procedure. Then we ask patients to wait there. Some evidence shows that if a patient rests for about 15 minutes after that procedure, the success rates go up. So what are the success rates? Well, they vary by the age of the patient, the underlying reason for infertility, and the medications that she may have been on. In general, and it's a broad range, in general, intrauterine insemination, or artificial insemination as it's sometimes known, will give pregnancy rates on the order of 5% to 20%. Now that means ongoing or take-home baby rates, okay? So 5 to 20% per cycle. Now, in a general population, one can anticipate that about 50 to 60% of couples undergoing that procedure will be pregnant at the end of 6 months. So it's not an especially successful technique, and sometimes that's hard to impart to patients. Another story. This woman came into my office, and her husband was a little bit of a cowboy, and this was their 3rd insemination. And he called me and said, hey, I'm outside in the parking lot, and if my wife doesn't get pregnant, I'm coming back in 2 weeks, I'm going to blow your head off. And I thought he was kidding, but then I heard the tone of his voice, and I called the police department, and the Orlando cops took him away. Never saw that couple again. Hopefully she got pregnant. Anyway, a lot of crazy things in our world, and thank you for joining me today. Wonderful having you here. If you have a private question, please send it to the link below, email me, and I'll try to get those questions in future episodes. Tell your friends to subscribe. Thanks so much.